Vintage Vinyl is mostly about music. We're a record store. We do sell some DVDs, but it's mostly CD and LP. We've been here 32 years. We are in the most heterogeneous neighborhood in St. Louis. It's the hippest neighborhood by a lot. We have 16 full-time and 6 part-time employees. And as the business grew, we came to the conclusion that it was really good for productivity. It was really good for our relationship with the people we worked for. And it was the only really moral thing to do, was to provide health insurance for our employees.
For Vintage Vinyl and so many small businesses like it, shopping for good health insurance is an expensive and time-consuming proposition.
Pretty insane, isn't it? That I spend between 4 and 6 weeks a year when I could be making money. I could be producing taxable income for the United States of America, and instead, I'm talking to insurance agents and pulling what's left of my hair out over how much more they want to insure an incredibly healthy staff. Some years where we've lost money, the difference between making money and not making money has been what it costs us to insure our employees.
The Patient Protection and Affordable Care Act offers small business tax credits that are already helping offset the cost of providing coverage.
I just finished doing the preliminary taxes for the year. We laid out close to $80,000 in health insurance last year, and we're going to get about 20% of it back. It's a great deal for small business.
As the health care law is rolled out over the next few years, new state-based insurance markets, or exchanges, will offer small businesses a more stable source of coverage.
One of the things that I think the exchanges are going to do is give me the benefit of a certain amount of cost certainty. I don't know until I actually bid out my insurance every year if it's going to go up 2% or 22%.
Prince believes the Affordable Care Act was a good first step for a country that has struggled too long to create a health care system that works for everyone.
I think it's really wrong for any strata of society to have access to medical care and for all of the rest to have to suffer and be sick or die, or watch their children be sick or die because of money. In a country as wealthy as this, it's just wrong. This bill needs to be just the foundation. It needs to be the beginning of sensible health care in America.